The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, everyone. You know, I've told everyone when we first started, there's so much news out there, Dr. Mencia, which is so scary. Whether it's local, a lot of people talk on the radio, and they're very hard on life. It's not very good. Everything's so negative. So when I came on at 5 o'clock, I said, stop thinking about all those things. Take care of your own life. Bring joy into your life. Make a difference, because it's going to be too hard and depressing. And you want to talk about heart disease, that's too hard on a person's heart.
It is. Touche. It is too hard. And now look at John River now, what happened with John River. And I had a patient that was going to go for a simple procedure in the office. And she said, I'm scared. I say, why? Well, look at John River. Look what happened. I said, well, there's a big difference here. You know, it was a decision that she made, and we all loved her. You know, she made us all laugh and cry, and, you know, wonderful person. But the decision was, do I go to the small clinic and get something done where there's no other doctor but the doctor doing the procedure, and there's no backup system, and she's so close to Mount Sinai Hospital. Well, I have the privilege of working at Mount Sinai, New York on Fifth Avenue. And when you go to a center like in our center, even for a simple dental procedure, you have the cardiologist can be there, me as an internist or geriatrician can be there, the dentist, the anesthesiologist. I mean, you know, it's a whole team of people. So it's not only one head thinking about everything that is going on during a simple procedure, but you have a lot of people working together in harmony, making sure that the outcome will not be catastrophic. Now, John River is well known, but there are many unknown people out there that go to these small clinics and they die too. We just don't talk about them. And we don't put them in an induced coma because they, quote unquote, is not what the media is looking at. We just let them die as they arrive to the emergency room. Now, how long John River was there, we really don't know, because she arrived at the hospital, and it could be political, it could have been a strategy to avoid a lawsuit, it could have been so many different things, but she arrived to the hospital and she was put on an induced coma. Now, why would you put a person in an induced coma after a procedure? It behooves me, you know. It doesn't make any sense. Why we want to do that? Unless the family say, well, keep the heart working until we land there, we arrive. Or keep it alive until we make arrangement. So, you know, there are so many different factors going on into this case that we really don't know. There's a lot of unknown. But as human beings, you know, we think of logic. And what about the common person out there that come to my office? You know, those are the John River of my everyday life. And my job is, you know, like I was telling my patient, you know, when you go to a procedure where the Dr. Gonzalez, you know, working in your vein or what have you, you know, we always aware of all the potential complications, and we are prepared for them. And it's like having that little bags with jewelry you don't use anymore, but they are there. You know where they are, and you know where to pick certain jewelry that are in there. So it's basically the same thing. We know where we have all the equipment in case of an emergency, but the system that we have created, thank God, is working so well by the blessing of God. It's working so wonderfully that we are able to help so many people with very little complications. And just yesterday, I was having a meeting with my chief financial officer, Rosemary from the dental department, Ina from administration, Tina from patient liaison coordinator, Mike from the manager from the entire dental department. We were talking about, moving to the new office, before we even step there, before we do the inauguration, I want to see that office open for a few days. I want to make sure the computers are working. I want to make sure you guys know where the needles are and the bandages are and this is, and that everybody is in tune so that we go there to provide great services, not just another office. I don't want to be just another office in West Palm Beach. We want to go there and provide a standard of care. We want to raise the bar.
That's very smart that you would do that, so that by the time the first patient comes in, you're ready.
Right. And by the time we do that big open house inauguration, everybody is already ready to roll and, and show now West Palm Beach what we have already shown for the past almost 20 years to Broward County.
Yep.
We have raised the bar. That now you see other group trying to see, well, let me see. And they come to my office. I have physicians that come to my office and they sit down and say, well, how do you do this? And what inspired you? And what is the system? And how does it work? And, I tell my staff, I say, the sun shines for everybody. And healthcare is so underserved that I'm always happy to share with other physicians what I have done, how I'm doing it. So hopefully other people get inspired, and we see more centers like this that is more integrated.
Good word. Good word, integrated, right? Yeah. I want to go back. We started out with the heart because of the women's heart. So, and we can talk about Joan Rivers, but we don't know that exactly. But before someone goes under any kind of a procedure, their heart should be tested, right? And I'm sure you do that.
Yeah, we do to any and all patients that come in and people that come and get checked. And last week is really when this topic was inspired, and I tell you why. I have this patient that came in, and, sometimes we think we sit at home and we have symptoms, and we come up with a diagnosis, by ourselves. Like yesterday, I had a mother who is my patient. The son have no insurance. So she came to see me, and the son is there with her. And the intention was like, please look at my son. He has this rash. And I said, sure, no problem. So I say, come sit on the exam table. Let me take a look at you. And then the mother get up. He got this rash for the past 2 or 3 weeks, and I know it's shingle. And I've been telling him, let's make an appointment with Dr. Mencia, let him treat you. So
was it shingles?
No, it was ringworm. It was ringworm. So I look and I say, Dr. So-and-so.
You called her a doctor, right? Yeah, right.
Dr. So-and-so, your son don't have shingle. He has ringworm. So we're going to put him on treatment for that. So I gave him a prescription, make sure he doesn't have any allergy and what have you. And we put him on treatment for ringworm. He has dogs. And so he has all the risk factor, And I have, a couple of students there with me. So they've, learn about ringworm.
They learn something from the master.
And get to differentiate between shingle and ringworm and what have you. So it was a good teaching for everybody. So sometimes, the patient come in and they come with their own diagnosis. And I just joking around. I say, oh, Dr. Anita Finley. Okay, good try.
That's right. No, I'm sure. Right.
So this lady come in and she say, I'm sitting down and I'm having this sweat. I just break down into this sweat. And discomfort on my right arm. And I think I need to get my hormone checked. I say, any shortness of breath? I say, I do get a little shortness of breath, but I'm 57 now, 58, I forget. It's her late 50s. So I think it comes with the territory. Mm-hmm. I say, where do you get that from? Tell me that 50 years from now. So she said, well, I just need to get my hormone checked. I said, excuse me, can I do something? She said, what? Can I be a doctor? Can I think with you? Can we just both think together here? And she goes, sure, Dr. Mencia, that's why I'm here. I said, no, you say you are here to get your hormone checked. She said, Dr. Mencia, at 58 or 57, if I'm breaking into a sweat, isn't that hormonal? I say, no, always. It could be your heart. It could be something in your lung. I want to see what's going on. I said, how could it be my heart? I don't have any chest pain. So I gave her an article, I say, I want you to go on the internet and look at heart disease in women and look at symptoms to educate yourself a little bit. But right then and there, I wrote the thing. I asked my staff to do an electrocardiogram for me. And it was completely abnormal to the previous one. So she was having what we call microvascular. So a man, and that's why the symptoms are so different between a man and a woman, because a man usually have the large blood vessel that get clogged. And when they get a heart attack, they feel a horrible chest pain. And they really feel it. They run to an emergency room. And the reason more women than men die from heart disease is because they don't get the typical symptom that we know in men versus women. So, one of the teaching thing on the on this topic today is for the audience to understand that heart disease in men and women can be completely different. It can be absolutely the same. And women, if she get the big blood vessel that surround the heart that are affected, she is going to get the same symptom that he's going to get. The chest pain, breaking into a cold sweat, the pain radiating to the left arm, or tingling radiating to the left arm, etc., etc. Nauseated. All of the symptoms a man feel, lightheadedness. All of those symptoms the woman will feel. If she has the major blood vessel being affected, the problem is, or the difference is that in women we have those microvascular heart disease. And what microvascular heart disease is, if I do a little drawing for you.
Okay, I love your drawings.
If you have that major blood vessel that surround the heart, and that blood vessel get clotted, this part of the heart that get the nutrients from that blood vessel is going to be affected, and it's going to produce pain. It's going to die, that part of your heart. In a woman, that same blood vessel, and in a man, you have tiny blood vessels that go inside the heart. And usually, the big blood vessel, nothing happened to it, but those tiny blood vessels, they get affected, and because they are so tiny, you don't even feel anything. So the woman might have no chest pain. They might complain of jaw pain, and they might go to the dentist. They might complain of back pain. They might complain of right arm pain, no left arm. So usually when a doctor hears right arm pain, you think of shoulder, think of neck, think of this. We think of everything but the heart. And especially like my friend came over and said, do my hormonal level. Then I say, okay, you might be going through menopause again, so let's do your hormone level. And we can start adjusting hormone and all of that, but we are not really getting to the root of the problem. So the take-home message is the severe chest pain, the prominent chest pain that men get, women most of the time will not see that. And most of them might experience absolutely no chest pain. So the unrelated symptoms that the women do experience is neck pain, jaw pain, shoulder or upward back pain.
Okay, but can I ask you a question? Why is that true? Why does it go to the jaw and to the neck?
It's just the way the nerves that innervate the heart. Remember, everything is coming from the brain, and it come down and innervate the eyes, innervate the skin, innervate the jaw, the teeth, and then the nerve keep traveling down, innervate your neck, innervate the shoulder, innervate their back. And to give you an example, when a person has an aneurysm of the major blood vessel, right on top of that blood vessel, one of the nerves that come from the brain, they make a U-turn and come back up. So any dilatation of that blood vessel start pushing on the nerve, and the nerve then irradiate. It's like when you have a sciatica, right? If you have a pinched nerve on your back, you might feel it on your thigh, or you might feel it on your calf, or it might radiate all the way down to your toes. So the nerve get pinched at one point, but the symptom travel like an electric shock. So the same thing with the heart. The nerve that are innervating the heart are also innervating many other things. So in a man, because of the major blood vessel and the nerve that is proximal to it, will have a tendency of radiating to the right arm. Where in a women, we don't see that. We don't see, because that's not what they normally get affected. It's not the major blood vessel that are surrounding the heart. It's those microvascular, those very tiny blood vessels that penetrate. In men, they can get symptoms like a woman. Same thing. And usually we see that in men if they have diabetes instead of high blood pressure. Instead of high cholesterol, they are diabetic. And diabetes is well known to affect the tiniest of the tiniest blood vessel in your body, that they are behind the eye on the retina, and they are surrounding your kidneys, and those tiny blood vessels that bring nutrients to the major nerves going down your leg. That's why they get a neuropathy, those tingling sensations that diabetic get on their feet. So diabetic get the same affection of blood vessel, the same type of blood vessel get affected as men with diabetes get the same as any women. So women tend to get in around the heart, not all over the body, not around the eye or the kidney, but when it comes to the heart, we see those blood vessels, and that's the answer to your question.
Well, this is such a coincidence. I just met a woman who's in the medical field. She's not a doctor, but she runs some very big HMOs. Mm-hmm. And she was telling me, and she does Pilates. She's small, thin, tiny. She runs. She's in great health. So she thought. Mm-hmm. So she said the other day that she was just feeling a little bit funny, and they went over to the beach, and her live-in said, "I don't like the way that you're looking. Something's not right about you." And she said, "Yeah, I don't know what." So they rushed her to the hospital, and turned out she had 95% clogged one of her, the veins. Her artery. And here's a woman who eats carefully. She does everything. She may smoke, and I'm not sure of that. I know her boyfriend smokes, but I'm not sure. But they had to actually put in 4 or 5 stents.
Well,
that's a perfect example.
That is
she could have died.
Example.
She could have died, right?
Because a lot of people, they have excellent insurance, and they say, "Oh, I'm not going to go and see Dr. Mencia. I exercise, I eat well." You'll be amazed how many people I see in my office that the cholesterol is a little bit off or what have you, or the sugar is slightly high, and they are pre-diabetic. And I say, you know what? I want you to see my dietitian, because I don't want you to start taking medication. Let's try to fix it up without medication. And they will refuse. They say, I eat healthy. Well, I'm a doctor, and I think those dietitians, they know better. They know a lot more than me when it comes to what I should be putting in my mouth. So, go and see the dietitian. For God's sake, let's try to help you out. You want a pill. I don't want a pill, but let me try on my own. And, people, they do go and they exercise, they do things. Preventive medicine is that despite doing everything right, there is something you can do nothing about it. And that is your genes, what you have inherited from your parents. So we have to accept what we have inherited in our gene, and that's when preventive medicine come in. A lot of people, I don't want an EKG. I don't have any chest pain. But an EKG, when I compare an EKG from last year to this year, and I see something start changing, and then we analyze those changing. What does that mean to us as physicians? Then we can move forward before this person get a heart attack. And she's a great example because
Great
she worked for
example.
an HMO.
She runs it. She owns this big HMO. She's with the doctors all the time, and you look at her. She's this tiny little thin person.
And a lot of times the HMO say, you cannot do an electrocardiogram if unless that person is dying, is having chest pain. We have to save money and do this. So we start cutting corner. Preventive medicine. How much money can we save if all of this can be picked up even before she has symptoms? The friend picked them up, not her.
No, yeah, he saw her, and he looked at her, and down the street, it's in my old neighborhood over in Ocean Ridge, is a cardiovascular surgeon. And so they called him. He met him at Bethesda, and he went right on, started the stuff immediately because he said
it was a classical
perfect of what you said. And I guess
it's,
she could have died with
exactly.
that. It's just what you were saying, which is everyone said, how could this happen to you? So it's just a perfect topic for you.
Absolutely. In a man, probably that man would have been having, if it's the friend that was with her, he probably would be having chest pain, radiating to the left arm, breaking into a cold sweat. And in her, look at her. She just didn't look good, quote unquote.
Right. And, he could tell something was
why,
wrong with her.
That's the awareness we want to bring out there when it comes to, person can also complain of shortness of breath. And if they are ex-smoker, they say, oh, that's because I used to smoke. Maybe that's why I have my shortness of breath.
But wait a minute, I know he's a big smoker, and he's gone to these other cigarette things. What do you call them? And they're not
vapor.
That's also the vapor.
We did a topic.
Yeah,
on
we
that.
did a topic on that.
There's some harm on that people are not aware of.
But for her, all the time being with him, I mean, that's secondhand smoke. So it would have almost been like smoking, right?
Of course. And there's now, with the Stop Smoking campaign that they have a couple of people that come on those advertisements that are people that are basically secondhand smokers that die from lung disease. So, it can affect you just like a smoker. So the other symptom the person can have, they can feel nauseated. So instead of going to the dentist, the person with jaw pain, this one goes to the gastroenterologist and say, I need to be scoped. Some gastroenterologists, they are very clinical oriented, and they might say, I want you to have your heart checked. And I had a nurse from the Broward district, Broward Health Center, and she came to see me, and we said, we need to see the gastroenterologist. We already checked the heart. And the gastro said, before I touch you, I want you to have a stress test. That was very smart of him. He said, I want you to have a stress test, get your heart checked, and she was so upset, being a nurse. He want to do my stress test. This is a waste of money. I say, how much is your life worth? This is for your life. This is for you. So I agree with it.
I have never had a stress test. Tell me what a stress test really tests you for.
There's two types of stress tests. You have the treadmill type, when you go on the treadmill and you walk, and we are trying to increase your heart rate. We basically put your heart through stress. We increase your heart rate and see as the heart is pumping faster, it demanding more oxygen, more nutrients from those blood vessels. So if you have any hidden heart condition, it will be overt. Now we can see it through the electrocardiogram as you are exercising. Versus if the heart is completely in great shape, excellent, you start exercising, you increase the oxygen demand to from the blood vessel, and the oxygen is coming in, then everything looks fine. We don't need to go any further than that. Some people, because of hip problem or knee problem, they cannot do the treadmill type. So we do what we call the chemical stress test. And the chemical we just give you, just like there are medication that can slow down your heart rate, there are medication that can increase your heart rate. So we give you an injection that will increase your heart rate, and it's less controlled than the other one, because this one basically what you're doing, you're going from like those race car drivers, from
Zero
to 100. So it raises your heart rate, and you feel like your heart your heart is gonna come
I
out
don't
of your
think I
chest.
would like that one.
No, but it's well controlled. It's not
Okay.
bad. Yeah, it is well controlled. If
Okay.
you have, problem walking, that's the ideal test to have done. Because some people cannot go on the treadmill and do a lot. But you still want to test the heart. So with that, we can inject, and we can control the injection so that we increase the heart rate at a control mode.
And
then we look at the again at the electrocardiogram, but then we take picture of the heart, and in those pictures we can see where the oxygen is being missed. So you look at the heart, and it's let's say red all over, like a donut, and there's one zone that is gray. So we say, okay, there's an area here that you are not receiving oxygen. Now, it could have been an old heart attack, or it could be something recent, and we can still distinguish that through the stress test.
Okay, so we have to give your phone number because we're out of time. The phone number is 954.
Wow, time flies.
I know, and you're having fun. 954-489-1345. 954-489-1345 is the Adult and Geriatric Medical Center. It's in Fort Lauderdale on Commercial Boulevard, and they'll be opening one in Boynton Beach shortly. But just make sure you go to their website, adultgeriatrics.com. They will also do home visits, and they're open on Saturdays. Right?
Yes.
I did it.
You did it. And the phone number in Hagen Ranch, Hagen Ranch Dental Medical, that's what it's going to be called. It's going to be on 12453 Hagen Ranch Road. That's the exact address. Boynton Beach, Florida, 33437. And the phone number there is going to be 561-270-6494.
Okay, but they're not open yet, are they? Can't call them there now.
I think if they call that number, it will jump to
the one in Broward right now.
One of the managers that will be attending to that office, and they will make appointment for you. If it's an emergency, they will bring you to Broward and take care of you. If it's not an emergency, they will come. We are going there at least once or twice a week to meet with people that want to talk to us free of charge.
Okay,
But it's been a pleasure.
Everybody. Thank you very much for listening. We're going to be back now with another interview. And Dr. Mencia, thank you always. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.